Alan Tittle here, Cleveland's medical malpractice lawyer. Folks, another type of case that we see a lot of times has to do with medication or prescription errors. The most common types of cases that we see are the wrong drug quantity, drug interactions with one another, when the medical provider knows that the patient has an allergy to the medicine, yet still prescribes it. Those are the three most common that we see. Some specific examples. There's a drug by the name of Coumadin or warfarin. It's a very beneficial drug because it prevents blood clots for those who have a heart condition called AFib. However, it can also be a very dangerous drug if not monitored properly. So folks, if you are on Coumadin or warfarin, your doctor has to be monitoring that drug in your blood levels, meaning how thin or how thick your blood is, in order to make sure that that drug is therapeutic. Otherwise, there's a big risk of you bleeding. And what I mean by that is, certainly if you fall and hit your head, you could have a brain bleed, but also just bleeding on its own. Again, very dangerous drug, but a very helpful drug. It has to be monitored. Another example that I saw in my own practice had to do with a drug allergy. So in one specific type of case, a client of mine had to have some surgery. And she had an allergy to a specific class of drugs, of anesthesia. She goes into the surgery, the drug allergy is in the system, but the anesthesiologist didn't take the time to look at her drug allergy history, gave her the drug. She had an anaphylactic reaction, anaphylactic shock. Oxygen was cut off to her brain, and she suffered a brain injury as a result. Folks, medication prescription errors are very scary. And if you or a loved one has suffered an injury or death as a result of a medication or prescription error, please give us a call or visit our website. Thank you. Take care.